Bismillahirrahmanirrahim. Assalamu alaikum, my respected audience. Today, my topic of discussion is about a rare genetic eye disease, that is cat's eye syndrome. If we talk about the etiology and genetics of this syndrome, it is basically because of an extra small chromosome having genetic material from chromosome 22. This extra small chromosome is responsible for abnormalities throughout the body, including the eye, and that's called the cat's eye syndrome. When we talk about the clinical features in eye, these patients usually present with low vision because they developed certain characteristic features in the eye, which we'll discuss and see in the future slides, because of the incomplete formation of the iris. Yes, and that incomplete missing tissue over there in the iris, in the retina, in the choroid, even involving optic nerve, is called coloboma. So this is the characteristic feature, and this is during pregnancy these features develop in the child, and these patients usually present with low vision, and once the vision is low, they may have also features of nystagmus. They may have irido, corneal colobomas, flat nasal bridge. Along with this, if we talk about particularly about cat's eye syndrome, their ears margins are low. The auditory canals can have stenosis, narrowing, and in the eye they may have an inner epicanthic fold, flat nasal bridge. These may later on develop cataracts also, and sometimes there is corneal cloudiness, and they may also present with Duane's abnormality. So these are a few features of these cat's eye syndrome, but the most important and prominent is the iris coloboma, choroid, retinal colobomas in the eyes. The classical triad of cat's eye syndrome comprises of preauricular abnormalities regarding ENT, ears, iris colobomas, and number 3 is anal atresia. So these are three most important features when we make a diagnosis. And if we talk generally what's going on in the body in these patients, they may have absent kidney, small kidneys, GIT, anal canal stenosis, narrowing of anal canal, genital problems, for example, cryptorchidism, and in female even they have genital problems, intestinal malrotation, they have usually short stature, and hernias may develop in these, spinal defect, limb deformities, hydronephrosis in kidneys, hernias. So not all, but some of these features can be found in these patients. Yes, these are different clinical general body features which I discussed with you. Towards the eye clinical features, these two slides are showing us the iris colobomas. If you please concentrate on the iris inferiorly, the iris tissue is missing over there. It is no more round, and it has taken an appearance of oval or elliptical over there. So the tissue is missing. This is the very important feature of the patients with the cat's eye syndrome. Next. Even in the retroillumination, it has been shown over there that inferiorly the iris is missing, and in the other slide it is shown over there not very good. In the future slides, further slides, we will see how retroillumination shows us the presence of inferior iris colobomas. Some other photographs taken from one side, and it shows that anterior chamber is well formed. There is no problem with anterior chamber, depth is normal, no shelving, nothing at all. Just these patients are showing the missing tissue inferiorly. Otherwise, cornea looks normal, anterior chamber is normal, there are no cataract changes, and iris is well formed superiorly, but that's inferiorly it is missing. Now we are using the retroillumination in our slit lamp by microscope, and here you can see the red reflex of the retina, which shows us that the pupil is no more typical round. It is oval in appearance, inferiorly, and very beautifully shown in this retroillumination. The other slide, which is about the fundus photograph, is showing us the chorioretinal coloboma. That's it. Yani missing tissue is not only in the iris, but it is also involving the inferior aspect of the retina and the choroid, and it is extending up to optic discs, optic nerves. In these fundus photographs, as the patient is having bilateral iris colobomas, so in the right and left fundus photographs, we can see chorioretinal colobomas. Yes, colobomas in the retina and choroid means that the retina and choroid have not properly fused together. There is deformity in the formation of, and in simple language, I can say a crater has been formed over there. A space is left over there where is no retina, no choroid, and as there is no retina, so there will be no photoreceptors in that area. So that is the, if we explain it in simple terms, that the tissue is missing in the retina and the choroid also, shown in both fundus photographs. There are some other photographs of the same patients showing us that exposure of the retina, and that no presence of the retina and choroid has left us to see the area which is basically sclera. Yes, there is no retina and choroid, and now we are seeing the posterior most layer of the eyeball. The OCT is done to assess the anatomical structures of the macula, but as I mentioned that the colobomas are encroaching the inferior part, so they have also gone into the macular area, so we cannot get properly the demarcation lines, all the layers over there, and once we come towards that area, these are missing over there. Let's look about the ultrasound findings in these patients. Here there is no aspect of we say that there is any retinal detachment or something like that. No, not at all. But here you can see that very clear-cut retina even suddenly comes to and abruptly comes to a halt over there, and we see over there a further deepening excavation over there in the retinal tissue, and shown beautifully in this B-scan ultrasound. That normal contour comes, and then it takes a further bulge. It is coming like this, and then it takes further deep bulge over there. This deep bulge is because the normal contour of the retina is missing over there. In this slide, you can also see that retina goes, and then there is a deep excavation over there, and that is because of the shown in magnified that the retina and choroid are missing, and now the last layer which is shown is the scleral layer, which is forming the eyeball boundaries. Here we discussed the eye clinical features, eye manifestations, and now we comes towards the general manifestations of these people, these patients. This is the MRI of a patient, and here you can see the red arrow is the pituitary gland, and it is very small in size. Yes, that arrow is showing us the pituitary gland, and it is very small in size over there, and because of this small size, there are certain abnormalities in the body when we talk about the hormones. Pituitary gland is the master gland, which controls functions overall in all the bodies. And when this gland suffers developmental malformations, developmental abnormalities, whole body systems come to a disturbance. Now we come towards the kidneys. Here you can see the red arrow and the red dots. These are the inferior margins of the kidney on the right side. This patient with cat's eye syndrome has got the right kidney. But when we try to see over there on the left side where I have marked blue lines and arrows, the kidney is missing. So this patient has got only one kidney. This is the pelvic section on MRI. Here we can see that in the red lines, the anal canal of this patient is stenosed, narrow inferiorly, even after the surgery. The surgery was done because these patients develop GIT and genital deformities. So the red dotted lines inferiorly is the anal canal, which is stenosed even after the surgery, and the blue lines are the vaginal canal, which is also affected genetically and has undergone surgery. So that was a very interesting topic I wanted to discuss with my respected audience. It is a very rare genetic disease, but we can still have these patients. Basically, from eye point of view, as I mentioned, they have got iris colobomas. Now, what is the treatment options for these? What we can offer, services we can offer? The first thing is that if they want a round pupil, they can use colored contact lenses. If a patient is interested and he wants the pupil to be round, that pupil reconstruction is an option. And apart from this, as I mentioned, that these colobomas are not only affecting the iris and pupil, they are also affecting the retina and the choroid. So vision is very low. So they need low vision services in the low vision clinics to get maximum benefit for the vision. But this disease is not a pure ophthalmology disease. We all have to move like a team. As I mentioned, patient will need urology services, GI, gynae ops. All these work like a team to give the patient a better quality of life. But from eye point of view, mostly we can do routine visits. We can check his vision, low vision glasses, contact lenses, and these things. And basically my recommendation is, rather than going for any surgical intervention, as much as from the eye point of view, if possible, we should go for the conservative, non-invasive management. If we find these patients and come to us as this is a congenital abnormality, and as I mentioned, they can have heart defects and all these things. But if a patient comes to an ophthalmologist earlier, so what we can do is we can keep an eye on development of amblyopia. Yes. If it is only one eye involved, for example, the right eye is involved, we can put regular patching of the left eye and closing for a few hours daily and monitoring the other eye, so that the eye which is disease eye, sick eye, there we can get maximum benefit, maximum vision, and prevent amblyopia as much as possible. Yes, this is very important thing in children age group who come to us, that the physician, ophthalmologist should keep an eye on the development of the amblyopia, I mean the lazy eye, and how it can be treated by regularly patching the normal healthy eye and putting the disease sick lazy eye to the maximum use. I hope by this discussion and topic will be beneficial to my respected audience in their clinical practice. I want to thank all of you for your attendance and attention. Thank you.